Good evening, everyone. I am Dr. Mulichan from India. Now I will tell about a main trick of FES. It is movement of back to front. What exactly mean by that? You take a ball probe, what right angle ball probe or J curate, and keep your J curate or ball probe behind the uncinate, that is behind the uncinate, and move forwards, that is back to front movement of your uncinate, and then use the debrider or with a Blakesley 45 Blakesley, whatever it may be, you remove it. So at uncinate we are coming back to front. Again the bulla posteriorly it may attach to the vertical part of the basal lamella, or sometimes a gap present between vertical part of the basal lamella and bulla. So again you keep a ball probe, 90-degree ball probe or J curate behind the bulla and move forward. So that is again back to front movement of your ball probe or J curate at bulla. Next, the vertical part of the basal lamella. So you pierce inframedially and keep your ball probe, and again you move the J curate from back to front, breaking the vertical part of the basal lamella. There you keep gauge piece for some time, wait for some time, and slowly you remove the post-rhythmoidal cells and try to identify the Onodi cell which is present posterosuperiorly in the post-rhythmoidal area, which is conical shape, and in the lateral wall of the Onodi cell you have to anticipate the optic nerve. So this posterosuperior Onodi cell, in the lateral wall of this Onodi cell you have to anticipate the optic nerve. This is how we can prevent the injury of the optic nerve. So this Onodi cell present posterosuperiorly to the sphenoid sinus. Again you keep a punch in the sphenoid sinus and move back to front, so by breaking the interval of the sphenoid. So this is more controlled way of doing the FES. This movement back to front is very important in FES. Similarly, in agar-Nash cell also, you keep a ball probe behind the agar-Nash cell and move front. So in such a way, this back to front movement present everywhere. 1. At uncinate process. 2. At bulla. 3. Vertical part of the basal lamella. 4. Anterior wall of the sphenoid. 5. At agar-Nash cell. So everywhere back to front you move with J curate or ball probe, and then in a controlled manner you debride or use 45 Blakesley, whatever it may be, you remove it. So so the main importance of this back to front movement is, if you go directly with the forward movement with debrider, catastrophes may happen. Without your notice, you may go into the orbit, or you may injure the optic nerve, or you may injure the sphenoidal structures. So always with simple instruments, even when you are using debrider also, with simple instruments like ball probe or J curate, first do back to front movement at uncinate, at bulla, at vertical part of the basal lamella, at anterior wall of the sphenoid, and above at agar-Nash cell at frontal sinus. Do back to front movement and break the corresponding structure and mobilize the corresponding structure, and then use the debrider or um, 45 Blakesley or whatever maybe, and you can remove the disease or the tissues in a controlled manner. So in such a way, this back to front movement in face is very, very important. Thank you.